Low blood sugar deprives your brain of its primary energy source, causing symptoms like confusion, dizziness, and even loss of consciousness. Think of it as your brain's way of waving a red flag, signaling that something is seriously wrong. Ignoring these warning signs can be dangerous, putting your health and safety at risk. For people with diabetes, managing blood sugar levels is a constant challenge. Skipping meals, taking too much insulin, or engaging in strenuous activity without adequate fuel can all trigger hypoglycemia. But even if you don't have diabetes, low blood sugar can still occur due to certain medications, dietary habits, or underlying health conditions. This isn't just about feeling a little shaky or lightheaded. If low blood sugar is not treated right away, it may be fatal. For this reason, it's critical to recognize the warning signals, take precautions, and be prepared to act in an emergency. In this video, we will delve deeper into the causes, symptoms, and most importantly, how to keep your blood sugar in check to safeguard your well-being. 1. Prescription drugs. Hypoglycemia or low blood sugar is a condition occasionally brought on by medications. This occurs when specific medications obstruct the body's natural ability to control blood sugar levels. One common example is insulin, a hormone used to treat diabetes. When too much insulin is taken or released into the body, it can cause blood sugar levels to drop too low. Another type of medication that can cause low blood sugar is sulfonylureas, which are used to treat type 2 diabetes. They function by encouraging the pancreas to release more insulin. However, on occasion, this excess insulin release might result in hypoglycemia. Other medications such as certain antibiotics, heart medications, and antidepressants can also lower blood sugar levels as a side effect. Research conducted by American Diabetes Association suggests that it's important for people taking these medications to be aware of the symptoms of lower blood sugar, such as feeling shaky, dizzy, or confused, and to monitor their blood sugar levels regularly. In addition, they ought to discuss any worries or side effects they encounter with their doctor when using these drugs. 2. Delayed or missed meals. When you skip meals or don't eat on time, your body lacks the necessary fuel to function properly. Blood sugar levels may drop as a result of this. Prolonged periods without food intake can disrupt the body's glucose balance. Glucose is the primary source of energy for our cells, and when it's in short supply, the body starts to feel the effects. It can cause you to become agitated or uneasy and hinder your ability to focus. In extreme situations, convulsions or unconsciousness might result. It's critical to consume regular meals and snacks throughout the day to prevent these problems. Stable blood sugar levels can be achieved with a balanced diet that includes fats, proteins, and carbohydrates. Planning meals ahead of time and carrying healthy snacks can prevent the risks of experiencing low blood sugar due to delayed or missed meals. 3. Increased physical activity. When you move around a lot, your body uses up more glucose for energy. Your body uses glucose, which is derived from food, as fuel. So when you're active, your body needs more of this fuel. Now here's the twist. If you have diabetes and take medicine to lower your blood sugar, like insulin, exercising can make your blood sugar drop too much. This happens because exercise helps your body use insulin better, so it can lower your blood sugar even more. Your body's sensitivity to insulin can be increased by regular exercise, which is generally beneficial. But for people with diabetes, it means they need to be extra careful to prevent their blood sugar from dropping too low during or after exercise. To avoid low blood sugar while being active, it's essential to check your blood sugar levels regularly, eat a snack before exercising if needed, and talk to your doctor or a diabetes educator about adjusting your medication or meal plan. 4. Excessive alcohol consumption. When you drink too much alcohol, it can interfere with your body's ability to regulate blood sugar effectively. Here's how it happens. Alcohol messes with your liver, the organ responsible for storing and releasing glucose into the bloodstream to keep your energy levels steady. When you drink excessively, your liver gets busy metabolizing alcohol instead of releasing glucose. As a result, your blood sugar levels drop, causing symptoms like dizziness, confusion, and even fainting. One fascinating study published in the journal Alcoholism, Clinical and Experimental Research found that alcohol directly affects the hormones that control blood sugar, such as insulin and glucagon. The fine balance required to keep blood sugar levels steady is upset by this intervention. Moreover, excessive drinking can also impair the function of your pancreas, which produces insulin, the hormone that helps glucose enter your cells. When your pancreas isn't working properly, it can't release enough insulin, leading to elevated blood sugar levels initially, followed by a sudden drop once the alcohol is metabolized. In summary, consuming too much alcohol can throw off your body's blood sugar balance, causing hypoglycemia and potentially serious health consequences. 5. Insulinoma. Insulinoma is a rare tumor that grows in the pancreas, the organ that helps control blood sugar levels in your body. Let's now discuss how it results in hypoglycemia or low blood sugar. Insulin is produced by unique cells called beta cells found inside your pancreas. Insulin functions as a kind of key that opens the cells in your body, letting glucose from your blood flow in and providing you with energy. When you have an insulinoma, these beta cells go haywire. Even if your blood sugar is already normal or low, they still create too much insulin. It's like a faulty switch that keeps pumping out insulin when it's not needed. This excess insulin grabs onto the glucose in your blood, causing it to plummet to dangerously low levels. Imagine insulin as a vacuum cleaner sucking up all the sugar, leaving your blood sugar levels too low. One scientific study published in the journal Endocrine-Related Cancer found that insulinomas often occur spontaneously, but sometimes they can be linked to genetic conditions. The causes of these tumors and the best ways to cure them are still being investigated by researchers. Understanding more about insulinomas can help doctors diagnose and treat them better, preventing episodes of low blood sugar. 6. Endocrine disorders. Endocrine disorders are conditions that affect the glands in your body, which produce hormones. These hormones regulate many essential functions including metabolism, growth, and reproduction. One common endocrine disorder that causes low blood sugar is called hypoglycemia. This can occur for several reasons. Diabetes is one cause, in which the body is unable to adequately utilize insulin or fails to create enough of it. Sometimes hypoglycemia can occur in people without diabetes. This is called non-diabetic hypoglycemia. It may occur as a result of hormone deficits, certain medical disorders, binge drinking, or meal skipping. The National Institute of Diabetes and Digestive and Kidney Diseases has undertaken research indicating that low blood sugar may also be caused by deficits in specific hormones such as growth hormone or cortisol. A shortage of cortisol can reduce the liver's synthesis of glucose and peripheral tissues' absorption of it. These hormones play a crucial role in regulating blood sugar levels, so when they are lacking, it can disrupt the balance and lead to hypoglycemia. 7. Critical illness. When our bodies are under severe stress due to illness, such as infection or surgeries, they may release too much insulin or not enough glucose to keep blood sugar levels stable. One fascinating aspect is the role of hormones like cortisol and adrenaline. During critical illness, these hormones are released in higher amounts, which can lead to increased insulin sensitivity and a decrease in blood sugar levels. It's crucial for healthcare professionals to closely monitor the blood sugar levels for critically ill patients and intervene promptly if hypoglycemia occurs. Treatment may involve administering glucose intravenously and adjusting medication doses to ensure blood sugar levels remain within a safe range. 8. Gastric bypass surgery. A medical treatment called gastric bypass surgery works to reduce weight by reshaping the stomach and altering the way it attaches to the intestines. One interesting effect of this surgery is that it can cause hypoglycemia. When someone has gastric bypass surgery, their stomach becomes smaller, which means they can't eat as much food as before. This can lead to less sugar entering the bloodstream after meals. Additionally, the surgery alters the way food is digested, which can make the body produce more insulin. When there's more insulin than needed, it can cause blood sugar to drop too low. Research conducted by the American Diabetes Association found that around 50% of patients who have gastric bypass surgery develop low blood sugar within 5 years after the surgery. This condition is called postprandial hypoglycemia. Patients who have undergone gastric bypass surgery must constantly check their blood sugar levels and collaborate closely with medical professionals to successfully manage any fluctuations. Thank you for joining us on this journey toward a healthier you. Don't forget to subscribe and stay tuned for more empowering content on health date, because your wellness deserves a daily date.